if you fuse more than two or two, how does that affect your articulation of the spine? If you're an active person, you exercise and whatnot.
Well, there are mainly two problems with doing multiple discs or multiple levels. One is it's a bigger surgery that'll take longer to heal, and there's a higher chance that one of those levels may not fully fuse. The surgery is called a fusion, but it's not a fusion until the bone actually grows and heals. And the more levels you do, the more likely one of those or more levels may not fuse. So that's one consequence of doing multiple levels. The other is the more levels you do, the more you do to change your back, the less normal it'll feel. So a one-level fusion for a problem is usually more successful than two or three. Of course, if your problem is such that you need a multi-level fusion for whatever kind of problem you have, then doing one-level fusion is not going to help you. But the bottom line is the less we have to change your back to make it better, the more normal it'll feel.
How's that going to affect your articulation?
You mean range of motion?
Yes.
Actually, I'm always surprised at how little the range of motion is affected. I mean, I rarely have somebody, no matter how many levels I've done, come to me and say, I don't like my back because it feels so much stiffer, or I don't have the same range of motion. The main thing people will be most concerned about is how much residual pain they have. And if the pain is not that bad or they're fine, nobody talks about the range of motion.